Acne scars, a reminder of those ugly battles we had with acne during our teenage years. While the acne is all cleared up now, somehow those scars still haunt us and can be disfiguring and a blow to our self-esteem. Comment below if you agree with me. Last video I talked about the types of acne scars. Today I will talk about the types of treatments available for acne scars and share with you some of my experience undergoing some of the said treatments. Hi, my name is William and I share science-based evidences on products, claims and effective methods related to health and beauty concerns so you can make an informed buying power. If you are new to my channel, do consider subscribing as I upload new videos on Fridays and click on the bell icon to get notified of new videos. When available, links to cited articles are provided in the description below. In general, acne scar treatments are categorized into two. An in-office procedures, meaning those that you do in the clinic by a professional, and at-home treatments, normally using topicals either over-the-counter or prescribed. In-office procedures can be divided into energy and non-energy based techniques. Energy-based techniques are basically lasers. All patients with boxcar scars, superficial or deep, or rolling scars are candidates for laser treatment. Different types of laser, including the non-ablative and ablative lasers, are very useful in treating acne scars. Ablative lasers achieve removal of the damaged scar tissue through melting, evaporation, or vaporization. Carbon dioxide laser and erbium YAG laser are the most commonly used ablative lasers for the treatment of acne scars. These abrade the surface and also help tighten the collagen fiber beneath. Non-ablative lasers do not remove the tissue but stimulate new collagen formation and cause tightening of the skin, resulting in the scar being raised to the surface. Among the non-ablative lasers, the most commonly used are the ND-YAG and diode lasers. Clinical and histopathological studies have previously demonstrated the efficacy of CO2 laser resurfacing in the improvement of facial atrophic acne scars, with a 50 to 80% improvement typically seen. Does it work? Yes, it does. I personally had a few fractional carbon dioxide laser sessions years ago. Although it works, do bear in mind that it comes with certain side effects as well. Besides the pain, several days of crusting and bleeding, especially on high-powered lasers, or ablative lasers showed high risk of complications and side effects. Now, lasers are pretty darn expensive treatments and you generally need to go high strength to see significant results. The problem is, doctors will always start with a low strength if you are new to lasers because they want to be safe and they want you to be safe. They need to start slow before shooting you with a high-powered one. It's understandable. So depending on severity of your acne scars, you typically won't get to see results in the first few sessions. Adverse reactions to the first generation of ablative lasers can be classified into short-term bacterial, hepatic, or fungal infections, and the long-term, which include persistent erythema, hyperpigmentation, and scarring. While laser smoothens out 70 to 80% of my skin irregularities, I am left with persistent redness on my skin, especially my cheeks, which is what I am trying to remove these days. On the other hand, non-ablative systems do have less side effects. However, the results obtained were not as impressive as the results from those using laser resurfacing. Non-energy based techniques include dermabrasion, chemical peels, needling, fillers, substation, and punch excision. Dermabrasion was the first major advanced treatment of acne scarring. Dermabrasion and microdermabrasion are facial resurfacing techniques that mechanically ablate damaged skin in order to promote re-epithelialization. Dermabrasion completely removes the epidermis and penetrates to the level of the papillary or reticular dermis, inducing remodeling of the skin's structural proteins. Microdermabrasion, a more superficial variation of dermabrasion, only removes the outer layer of the epidermis, accelerating the natural process of exfoliation. Unlike dermabrasion, microdermabrasion can be repeated at short intervals, is painless, does not require anesthesia, and is associated with less severe and rare complications. But it also has a lesser effect and does not treat deep scars. In addition, dermabrasion does not improve ice pick or deep box scars optimally. Chemical peeling is a process of applying chemicals to the skin to destroy the outer damaged layers, thus accelerating the normal process of exfoliation. Different agents have different depths of penetration, and therefore chemical peels can be divided into 4 different groups based on the histologic level of necrosis that they cause. The following table shows the different types of acids, their concentration and effectiveness on the skin layer. Think of chemical peels as controlled chemical burns. Yes, doctors apply chemicals, make your skin to burn, and they shed off, revealing fresh, new skin. Types of acids used include glycolic acid, trichloroacetic acid, lactic acid, salicylic acid, pyruvic acids, and phenols. Skin needling, also called collagen induction therapy or needle dermabrasion, is the technique of rolling a device comprising a barrel or roller studded with hundreds of needles, which creates thousands of micro punctures in the skin to the level of the papillary to mid-dermis. With this technique, the rolling is usually continued until bruising occurs, which initiates the complex cascade of growth factors that finally result in collagen production. Results generally start to be seen after about 6 weeks, but the full effects can take at least 3 months to occur. And as the deposition of new collagen takes place slowly, the skin texture will continue to improve over a 12-month period. The optimal scars to treat with skin needling are the same as fractional laser resurfacing, rolling acne scars and superficial boxcar scars. Compared to other resurfacing procedures, this technique has many advantages. First, it is proposed to be safe in all skin types and to carry the lowest risk of post-inflammatory hyperpigmentation when compared to laser resurfacing, chemical peels, or dermabrasion. Second, the treatment does not result in a line of demarcation between treated and untreated skin. Third, the recovery period of 2 to 3 days is significantly shorter than other resurfacing procedures. Injectable fillers can be used to augment soft tissues, particularly in soft atrophic rolling or boxcar scars. Fillers can be classified as temporary, semi-permanent, and permanent. Temporary fillers typically last for a few months, making repeated treatment necessary, which increases cost. The injection of hyaluronic acid fillers stimulates collagen production by fibroblasts, augmenting soft tissue and improving the quality of the overlying skin. Semi-permanent fillers can last up to 2 years and can stimulate fibrous tissue formation, whereas permanent fillers comprise larger particles that cannot be phagocytosed or broken down by the body. They can last several years to lifelong and can be displaced over time due to changes in the adjacent connective tissue. Adverse effects can be permanent and might require a complete removal. Silicone is relatively cheap and is stable for 10 to 20 years. Polymethyl PMMA is a synthetic permanent filler suspended in bovine collagen and lidocaine. Commercial products include Article and Belafil. Ooh, I had this before too. Scary. Substation is a procedure in which a needle is inserted under the skin and passed in multiple directions. Substation is best utilized for rolling acne scars that have normal quality of skin at the base of each scar. It is less effective for treating box scar and ice pick scars. The mechanisms of scar improvement are releasing fibrotic strands underlying scars, organization of blood in the induced dermal pockets, and connective tissue formation in the area. Let me tell you that this is painful as shit. And after the session, my face looked as though I got bitten by a tiger. There were so many bleeding points and my face had bruises all over for a good whole week. I wouldn't want to go through that again. Punch excision is indicated for ice pick and boxcar scars. A punch instrument approximately the size of the scar is selected, followed by excision of the subcutaneous layer. Punch excision also works well in conjunction with laser resurfacing, whereas punch elevation is best suited for treatment of broad boxcar scars without thickening of scar tissues or fibrosis. And there you have most, if not all, the in-office procedures used for acne scars treatment. While I've experienced laser and substation, I may consider trying chemical peels in the future for general skin rejuvenation. Reminder, I am not a dermatologist nor a skin esthetician. All this information is based on my personal experience and research. Please consult a licensed practitioner for your professional acne scars treatment. If you are a professional who is watching this and find that my information is incorrect, do let me know. I will appreciate that. Till then, I'll see you again in my next video where I will talk about at-home treatments for acne scars. Bye bye!